Hey everyone. This research report will present the findings of a recent study. Does a history of cannabis use influence onset and course of schizophrenia? Published in April of 2023. This study was conducted for the purpose of deepening an understanding of the effects of cannabis use on schizophrenia spectrum disorders, particularly in the context of early adolescent use. So, historically, the use of cannabis has been reported to increase risk of developing schizophrenia spectrum disorders. It was also suggested that brain function could be impacted by THC exposure during the developmental years. However, this causal relationship suggested in studies didn't provide enough clarity. Many of these are based on cross-sectional data, meaning that cannabis use was measured retrospectively, without any way to know whether use began before or after onset of schizophrenia, or when it was most frequently used. When researchers then performed a systematic review of some longitudinal studies, it was revealed to them that cannabis use was associated with an increased risk of relapse and rehospitalization for patients with schizophrenia. But these longitudinal studies only used follow-up periods of a year or two, with one study covering a 10-year period. But there's also a lot of variability in reports of the differences in symptoms between cannabis users and non-users who have schizophrenia. There are conflicting results from studies that report higher occurrences of positive symptoms, while others report no change. Additionally, researchers were also unable to find any studies assessing use in adolescents at all, or as it relates to the development of schizophrenia, that is. So the study aimed to answer whether cannabis use in adolescence was linked to an earlier onset, type of onset, or any difference in clinical characteristics, its course, or outcomes of schizophrenia. So researchers conducted a longitudinal review of medical records based on a cohort of Swedish men born between 1950 and 52 who were compulsorily enrolled for military training between 1969 and 1970, at which time the men would have been around 18 years of age. The conscription process involved a self-report questionnaire about drug use, including what type and frequency of use. With permission from the Ethical Review Board, conscription documents were linked with information from the National Patient Register. In total, 24,875 persons were evaluated for the criteria and identified 569 people with schizophrenia or other psychotic diagnosis. Patient records were pulled from all parts of the country, both urban and rural, in order to encompass all types of care, like university hospitals, special centers for mental illness, and regular hospital clinics. The records were examined by a board-certified psychiatrist specialist using the OPCRIT system, which is the operational criteria checklist for psychotic illness, and this psychiatrist was blind to cannabis use reported at conscription. Many patients were not included in the study because they did not meet the OPCRIT criteria, and some clinics required consent from patients to access medical records, which the Ethical Review Board did not permit for this study. So this narrowed the sample down to 168 patients, which was then whittled to 158 since 2 patients had only outpatient records, 4 individuals reported the use of other drugs, and another 4 had a psychosis diagnosis at the time of conscription, so it predated the beginning of their study. So researchers found that the mean onset age for schizophrenia with a history of cannabis use was 23.4 years, with a standard deviation of 6.6, and for those without a history of cannabis use, mean onset age was 27.7 years, with a standard deviation of 9.3. It's about a 4.3-year difference in age of onset, which is pretty significant. Researchers didn't find any significant changes in long-term clinical outcomes, and little evidence that marital status or employment status played any role in any differences. Between groups, there was also no significant difference in symptom profiles, being both delusions, hallucinations, positive symptoms, and more negative, disorganized symptoms. However, when looking at admissions to hospitals or clinics, patients with a history of cannabis use had both a higher median of hospital admissions, about 8 to 20 of those with a cannabis history, but also a higher median total number of days spent in the hospital, about 273 for non-users compared to 877 in the cannabis group. Another important note from this study was the prevalence of a cannabis abuse/dependence disorder developing in individuals who used cannabis during adolescence. Of the individuals who reported having used cannabis at their compulsory military training at 18 years of age, 23 of them, or about 72%, were documented to have cannabis abuse or dependence disorders later in life. And those are the only ones that are documented. But compared to the group who did not use cannabis at the time of their adolescence, only 11% of those patients developed a dependence disorder later on. And of those who reported the most frequent use of cannabis during adolescence, 12 out of 13 went on to develop medically documented cannabis abuse disorders. So I suspect this kind of research may continue to come out as we begin to study cannabis more frequently. As young adults in the country moving towards regulation of legal cannabis, I think we should all be aware of the potential risks of early adolescent use of cannabis. Thanks for listening.